It's Aloha Tuesday. 2 days for Thanksgiving. Yes. How you, Charles?
Doing fine.
Look at this, Charles.
Look at this.
I want to thank. I'm gonna put it up a little later when we get more people on. But how you been, bro? Turkey, take your turkey out to defrost. Oh yeah, turkey dime. I even like turkey, but I'll eat it. But it's not my favorite bird. I like duck. I like chicken. Sometimes turkey, but I'm gonna partake in some turkey on Thursday at my brother's house. Looking forward to it. Lots to be thankful for, man. Lots to be thankful for. We all have lots to be thankful for. Anyway, how's your day, bro?
Long, long, and long. So
I know, man. I know
I
the
said,
feeling. I know the feeling.
but I don't, you know, try do the kind of hours I do. It's like, oh,
That's why, Charles, you need to load up. As you guys know, I don't eat much candy. I don't like candy. I mean, I do, but it's just something that as I get older. But I want to thank my pops. There he is, Thomas Raposo. Dad sent me this and in the mail, and I'm just gonna inventory real quick. Charlie, Snickers, Baby Ruth, Three Musketeers, Snickers, 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 100 grands, one more 100 grand, and four of the Hershey's with almonds to make it healthy.
well, let
All
me,
of this, all of this from my pops there from Seattle. Dad, thank you, love you,
let
appreciate
me,
the candy. I might even crack one open tonight.
let me show you what I got with my little bag. One bag, two bags, three bags, four
Well,
bags, five
I
bags.
just
But you see, it's an illusion. How you do it? You take one bag, you take it out of camera view, you move it around, and you come up with that same bag. Let's go one bag,
wow.
two bags. Anyway,
This is dedicated to you, Charles.
I moved
So
on to my Skittles.
no,
Number
say
one,
that. Now my father, now my dad gonna send me a case of Skittles.
I moved to Skittles because one, it's small, it's very flavorful, it lasts a long time, and it's just like tonight I just gonna have one. So far I had only six, but I'm gonna have just one big bag.
Well, I
But
I
anyway,
will. I will. Yeah. Anyway, hey, so we got Dr. Dworkin tonight. Dr. Dworkin, renowned author. Now I know a lot of y'all got his book in the mail. I still haven't gotten mine, although I think I ordered first. But anyway, we'll deal with that later. But I'm very curious to see what he has to say about today's announcement from the governor and from the mayor Blangiardi, who I think he believes he's a doctor because a lot of the things that he was saying, should have been said by a doctor, but he took it upon himself. He believes that pretty much it's over. He believes that it's time to open up. He believes that it's time to what word did he use? I forget what. Mingle, 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 guys. Go out and mingle. So I expect, and I hate to say this, guys. I hope I'm wrong, but I expect some major surges on Oahu after this Thanksgiving and Christmas holidays because of the restrictions being released. I mean, just no social distancing, um, no 100% capacity. Yeah, you got to wear a mask as long as you're not eating and drinking. So when you're in a bar or in a restaurant, guess what you're doing? You're eating and you're drinking. No social distancing. And the most important change, I think, was starting December 1, the mayors will be in control of their counties. So the mayors will now dictate what happens in their counties. Interestingly, Mayor Blangiardi, of course, he was the leader today, and then you had Mayor Victorino and Mayor Roth, but our Kauai mayor wasn't on. So I'm waiting to hear what Derek has to say and what his plan is going forward. Do we release or reduce the restrictions like Blangiardi did, or do we keep status quo? Understanding Kauai has the highest positivity rate, the highest cases per capita in the state. So interesting developments today, and I'm dying to hear Dr. Dworkin's comments on them. What are your thoughts, Charlie? Real quick, I know Dworkin's in the green room, but
Well, it's quite obvious we are, and I'm going to ask him a question. If we depend so much on visitors, right? And yet, if you look all around us, there's an outbreak in almost every state now. Abroad, you look at Korea today, their numbers are skyrocketing. What makes our local administration think that it's not going to come here? I'm just curious.
well, it's South Korea. It's all over the world, and yet was interesting because in the governor's comments, in his closing comments, he welcomed. He said he wants the world to know Hawaii is open, and that international travel is going to build up, and it's going to really help out our visitor industry. And that was what his comments were.
Hmm.
So I'm a little concerned, Doc. I welcome. I see your Wi-Fi signal is a little low, so um, hopefully we can. I hear the cookies though, so I know you. I know you can hear us, and we definitely can hear the cookies. Welcome, Doc. How are you, my man?
Good. How are you guys doing? Can you guys see me all right?
Yep.
Yep, we can see you and we can hear you, and
Mhm.
just happy to have you on the show. I know we have a lot of our viewers that received the book, read the book, are excited. Some have even read it twice and even three times. I'm still waiting for mine, but that's okay. I'll get it sooner or later. But they love the book, Doc. Sounds like you got a home run, buddy.
Well, thank you. That's good to hear. I'm glad people like it. Put a lot of work into it, and certainly it was a humbling experience. To go through it. It's nice that it's finally just like released into the world, and I no longer have any control over it. And some people love it, some people are going to hate it, and I'm done with it, man. I feel
Well,
like
I
my
think
kids
the
turned 18. So I'll
I
see you
think the
next week.
civilians, I think the civilians, the non-elected, the non-special interest people are going to love it, and I think the elected people and the decision makers and the special interest probably going to hate it. But who cares? Sometimes the truth hurts. You provided the truth to a lot of people, and I want to personally thank you on behalf of all our viewers. Thank you for doing that.
Yeah, thank you. I mean, I try not to fight with individuals in the book. I tried to make it about ideas and not individual people. So there's a tactful tone. The first draft of it might have been a little bit more aggressive, and I had an excellent editor who I think helped make it better. So hopefully it'll be readable to a wide variety of people. That's what I'm going for.
Well, I think from what I gather from, and I purchased mine because one of your viewers who just loves everything about the book. the first thing she said was, "Uncle, you're an Uncle Mel. You're on one page 121, and you're also in the back where all the credits." So I like to give a shout out to Melissa Bolton, as well as thank you, Doc. And one of the comments, I found it to be very true. She says that your even though there was disagreements in some areas, but you were very humble about it, because there are some who may not like what certain things are happening, but they will once they get a person knocked down, they will start kicking them and all. But you're very humble on your attacks. You're just stating the facts, being very factual about it. And so that was very appealing to many of the readers that I received comments from. So I want to thank you on behalf of the readers, and hopefully one day they get to thank you themselves. And so
Yeah,
someone's asking right now, what's the name of the book? And can you tell the audience what's the name of it?
sure. Actually, I got a copy. Hold on. So this is what it looks like in print. It's called Plague Doctors: How Hawaii Battled the Pandemic, and I got to thank Watermark. The company did a great job. This is a local Hawaiian publisher, and the formatting, the printing is beautiful. I mean, it really came out very high quality. I hope the writing holds up to the quality of the publishing. But here's the table of contents. Yep,
Yep,
I think I can get
right
it
there.
up.
Hmm.
Yeah. So I tried to organize it by theme, and it's chronological. It starts with an introduction, which takes us a little bit through the setting in Hawaii,
Hmm.
and I kind of introduce what I think are the central themes. Geography, the history of epidemic disease,
Hmm.
the horrible injustice that happened to the Hawaiian kingdom with epidemic disease. And I use that as a segue into the COVID-19 discussion, and then it kind of just starts rolling. I mean, the first chapter on emergence is a little bit theoretical. It's about what I think leads to diseases emerging, um, with some discussion of COVID-19 in particular. But from there, it just starts rolling through my experiences from the beginning of the epidemic as an ID guy in Honolulu, and all the different characters I encountered. The people that I hit it off with, the people who couldn't stand me and got rid of me as quickly as possible. It's all in there, and I try to be nice about it. I'm not looking to trash individual people, which is always a danger with a memoir because of course disagreements happened, but I didn't want it to be that kind of a book. So it's just my perspective on how we went through the first year. And there's a lot on Oahu. There's a lot about the Big Island when I move over to the Big Island. There's a fair amount on Kauai too, even though I wasn't on Kauai during the pandemic, just because I saw the response there is so exceptional, particularly the first year of the pandemic. And
Hmm.
I know there's some issues bubbling up now, but there's just a lot of discussion of what was an effective response from my perspective as an ID guy, and then just the clinical experiences. My feelings as it was happening. There were some hairy moments, particularly at the beginning. And Melissa and I have chatted about that offline quite a bit because I know she went through something very similar at Straub. And I'm very appreciative, Melissa, if you're out there for the support you've shown me and the interest in the book. And obviously, we're kindred spirits. We've seen a lot of this the same way. So yeah, I'm excited about it.
Well,
Hey,
I would like for this book, because just by the from what she shared,
Yeah,
I'm one of those investigator buffs, I guess, because it was our previous life as in law enforcement. But a lot of these books written about like the local syndicate, everything local, and this your book kind of falls in line with that, how it's laid out
yeah,
and what it shows, and so it makes it very, very, very intriguing that once you start, based on what I've gathered so far from Melissa too, that once you pick it up, you don't want to put it down. So she gave me a play by play. She goes, "Uncle, I'm on this chapter. I'm on this chapter." And the first day, and she read through the whole thing, and she goes, "I'm going to read it again." So that's what prompted me to say, "Man, I you paid a little extra for the rush job on the from your handlers for this book. And I kind of want I kind of want everybody to get your book if you haven't already gotten it, and hopefully at the end of the show we can show the place of where to get it. And
Yeah.
are you planning on having any signing
Yeah.
sessions?
Yeah. So a couple things there. So the book itself, there's a little bit of zooming in and zooming out, and that was kind of a conscious decision on my part because it's mostly about the pandemic and how we handled it in Hawaii. But obviously, what happened elsewhere was influencing us, particularly what was happening on the mainland of the United States, but also how we saw effective responses happening internationally. And I was very impressed by some effective COVID responses early on, particularly in Asia and in other Pacific countries. So there's a little bit of zooming in and zooming out, and for a while, particularly the first half of the book, I'm kind of going back and forth from the zoom in to the zoom out, and then the last few chapters really focus more, especially on Hawaii again in particular, as we get into the vaccination phase of the pandemic. And my original plan was to end it with the vaccination phase, not because I ever thought that would be like the definitive end of the pandemic, but just because you got to end the book somewhere. And
Mhm.
I was looking for a logical endpoint chronologically, and we got to April or May, and I had to turn the thing in. We couldn't keep fiddling with it. But then with Delta over the summer, I ended up writing an afterword, which I appended at the end to sort of update us through variants in Delta. So, and even now things are again, of course, changing a little bit. So, I'm not under any illusion that this is going to be the be all or end all or the definitive statement or the last word or anything like that. But I think what I'm hoping is it's a good and entertaining to read summary of what it was like when the pandemic hit and the first 12 to 18 months through the pandemic, which I do think is going to have been the hardest part of it. And I hope it ages well, and that in some future crisis, and there will be another pandemic, there will be other environmental challenges that we face that are existential in their nature, like this one was, and we should have things that we can hold on to, that we can look to, that can help guide us in the future. And in my mind, that's what a good memoir does. Like when I think of memoirs that I've enjoyed reading, I pick it up and I'm relating to somebody. They might have been dead 2,000 years. I'm with them, and I feel like, okay, I can handle a problem because this person handled this problem, and there's this common humanity that can span time and geography. So that's what I was aiming for. I don't know if I hit it, but hopefully it'll hold up. In terms of book signings, I would love to do in-person book signings at some point. I mean, I guess it depends a little bit what the demand is. People have contacted the publisher and asked me to sign things, and the publisher has been sending me individual copies in the mail to sign and then remail to people. So we've been doing some of that. At some point, when in-person things are happening and are a little bit safer, maybe we can do something outdoors. I'd be happy to go to Oahu again or go to Kauai and do a signing. On the Big Island, I just got a bunch of copies. I've been signing them and handing them out. So I guess it depends, but I'm open to whatever people want me to do.
Well, you'll definitely have a table and do some signing. It's at Charlie's concert at the end of the pandemic, and which, if you listen to the Honolulu mayor and the governor today, seems like we're there. Seems like we're there. So we might be able to do the signing on Oahu without any problems, because
We
it
could do
doesn't
whatever we
seem like.
want on Oahu. The only question is
Yeah,
it
yeah.
smart? Is it smart? We could do a keg stand on Oahu. But
It doesn't sound like COVID is going to affect people on Oahu. I mean, I kind of want to talk about that. We did want to get the books out of the way. Guys, I posted the link there. If you go to Ed Horry's comment, look in the post, all the comments. Ed has the link. It's bookshawaii.net. Just remember bookshawaii.net and search up Plague Doctors or Google Plague Doctors, Dworkin.
it will be on Amazon at some point. But Watermark is one of the few remaining independent Hawaiian publishers. So it's on their website first, and that's on purpose. They wanted people to support local publishing, and I think that's a good thing to support, because there used to be a lot more local publishers, and Amazon's put a lot of them out of business. So they did a great job editing, crafting, formatting, everything. So that it's up there, and it'll be up there for a while, and then it'll eventually migrate over to Amazon.
Well, thank you so much for supporting the local publishing. I mean, that's you know that's what it's all about. Aloha, man, sharing and supporting local. All right. So now the big news today, December 1st. It's up to the mayors now. It'll be up to the mayors to manage COVID on their in their counties, except obviously for safe travels. But capacities, vaccinations, and so forth. Honolulu is they're starting off with a bang. I mean, 100% capacity, outdoor events, indoors, bars, restaurants, concerts, football games. In fact, now you can even eat and drink at outdoor gatherings with no social distancing requirements and absolutely no capacity limits. What are your thoughts, Doc? And I don't know how you're going to answer this. I'm curious. And by the way, you mentioned ID a lot in your, for those of you that don't know Dr. Dworkin, Dr. Jonathan Dworkin is a infectious disease specialist. All right, that's the ID he was talking about. I know a lot of you thinking, what the hell is ID? Infectious disease. That means he knows what he's talking about. That's what that means. That he knows a little bit about infectious diseases. When you listen to Blangiardi today, he sounded like he was the infectious disease specialist. He already made the comment that we're endemic and that we have suffered enough and now it's time to go celebrate. It's a day of celebration. But tonight we have an infectious disease specialist. What are your thoughts, Doc?
Yeah, I mean, we've had a lot of false starts in terms of reopening, and I was speaking offline with some of my colleagues earlier today that every time in my own mind that I've set a point as to, okay, we're going to hit such and such a point in the pandemic, and then we're going to be able to take the masks off, then we're going to be able to open up, then we're going to be able to do this, then we're going to be able to do that. Every time I've tried to define clearly in my mind what that point is, we start to approach it, and the disease is just worse than I'm comfortable with, and I end up in my own mind kind of backing off a little bit. And we had a version of that earlier in the year, as you guys recall, where pre-Delta, the state was talking about relaxing restrictions when we hit 70% vaccinated. Well, then Delta hit. The state's now, I think, at 72, 73% vaccinated. And, we still haven't backed off. And I think that was appropriate because we were at 60 something percent vaccinated and Delta hit, and it knocked us on our butts. We were back in early 2020 with the hospitals being threatened, people dying every day, a lot of deaths over the summer and early fall from the Delta wave. And that to me was very sobering. So I once again am trying to define in my own mind, well, what's the point at which we're really clear? And what I'm seeing is that the infection still has the capacity to come back, to produce a lot of cases, to produce a lot of hospitalizations. I don't think we're out of the woods yet in regards to having a lot of cases and having a lot of hospitalizations. And I don't know if it's possible to get the graph up that I sent earlier. I can try to get it on my computer, but oh, wonderful, thank you. This is from Our World in Data if people are interested in it. And what you see on the bottom on that x-axis is the percent of the population that's been fully vaccinated, and going up and down on the y-axis is daily deaths per million, the 7-day average. And this was mid-November. And there's a pretty obvious trend line there, although there's a fair amount of variation around it. And that's because the case rate is variable depending on geography. Right now, there's a lot more cases happening in Europe relative to other places. So the Europe countries are the red dots. But what you see is mortality definitely drops as you get a very high vaccination rate. And the countries that have the highest vaccination rates, 75%, 80% or better, even when they're having cases, they're not having a lot of deaths. And so that's one possible marker. And what you see is where we were in the summer when Delta hit, we were around 60%. Well, you can still have a fair amount of deaths at that rate. Look at Hungary, look at Greece, look at Austria, right? Look at the Czech Republic, right? And look at the United States. The United States is on this as one of the blue dots, 58%. Well, that's where our tourists come from, the majority of them, from this country, which is not doing very well. relative to its peers in terms of getting people vaccinated. So are we out of the woods yet? My short answer is no. I don't think we're out of the woods yet. I think even in Hawaii, where we have a 72% vaccination rate, that's pretty good, but it's not 75%, it's not 80%, it's not 85%. And even in the countries where there are 80, 85%, you can still see a lot of cases, but you don't tend to see as much hospitalization, right? So then the question is, okay, so what do we really need to do to be safer, to be able to open and stay open without having the hospitals really take it? And I think if I had to break it down to like three big recommendations, one would be get the vaccination rate to 80% or better, by hook or by crook, and no excuses. It's just something we have to do. And I've been preaching this to the mayors now for months. And, Blangiardi, to his credit, has taken that part of it seriously. The other mayors, not as much. What else do we need to do? Well, it'd be nice if we had rapid testing available for everybody. And I know the Department of Health is really trying to scale that up dramatically and get it into the places where it's needed the most, so that we can make family gatherings safer, make opening events safer, make all kinds of gatherings safer. And the other big one, vaccine related, is boosting. And at some point tonight, we should discuss what's going on with waning immunity and boosters, because what that graph shows is that vaccine rate, fully vaccinated, does correlate with mortality. But what it doesn't really address is waning immunity and boosting. And there is better and better data now coming out suggesting who needs to be boosted, what's the best way to do it. And I think we really need to much more aggressively push to get the adult population a third shot. And I'll go through that data with you guys if you're interested. But if I could push three, no, I'm going to push four. I'm going to give one more. So I said get us to 80%, get a third shot for everybody who needs it, which at this point is essentially all adults, but in particular all elderly and all people with comorbid medical conditions. Scale up rapid testing. And make that widely available. And then the fourth, and this is coming right around the corner, guys, is oral antiviral therapy. I think the FDA is meeting at the end of the month to discuss the first of a couple of emergency use authorizations that are likely going to happen for oral antiviral therapy. So if we have widely available oral antiviral therapy, in other words, you get diagnosed with COVID and within 24 hours, you're taking a pill that reduces your chance of getting hospitalized by 50% or more. That changes the ball game, right? Because the high vaccination rate is going to lower the mortality significantly, and then a good oral antiviral medicine may lower the mortality another factor of 5 to 10. And then we're really in the realm of talking about a less dangerous viral illness. I think this illness is still dangerous. It still has the capacity to surge very quickly and to threaten healthcare capacity and to make people sick much more so than, for example, influenza could. But we may soon be at a point, if we do these things, where that's not the case and where opening up would be significantly safer. But I don't think we're there yet. And if we don't do those things, we won't get there, right? If we stall out at 70%, if we don't get the elderly population their third shots, if we don't scale up rapid testing, if there's a big delay in getting oral antiviral therapies, then we stall out where we are now. And then the opening is going to go, I think, fairly predictably in a bad direction. So I don't have a crystal ball, but that's how I'm thinking about it.
Real quick, follow-up questions to what you just said. Number one,
Yeah.
Even Blangiardi today, he mentioned the number 90% vaccinated. It's not true. We're not. They play with the numbers to make it seem we're not even close to 90%. But my question is this, and you mentioned the waning immunity. When they give us the fully vaccinated numbers, that's only counting the people that had a second shot or a first shot of J&J. That's not counting the people that didn't get boosted. So we're dealing almost like a whole new. Yes, there is some immunity levels if you didn't get boosted, or 8 months, 9 months, 10 months after your second shot, but still, that has to be put into the formula if we want to get an accurate number of protected people in our communities. Wouldn't you agree?
That's right. And Eric Topol, who's been a force online recently. He's a cardiologist, I think, in California, who does a lot of the literature review stuff in real time. His whole point, looking at the U.S. mainland data, was, okay, you've got 40% of the country that hasn't been vaccinated at all. You've got 60% that's been vaccinated, but half of those people, it's more than 6 months ago. This is a formula for disaster. Like, we know what's going to happen. We know the mainland is going to blow up if we don't do something different than what we're doing. And I think Hawaii is in a slightly better situation than that, but not fundamentally a different situation. We're at 70% rather than 58%. So that's better. And you're right. 2 shots is way better than 0 shots, right? And 3 shots is better than 2 shots, but 2 shots is way better than 0. So I think, if I had to choose between those goals, it would be get the number of people who go from 0 to 2, as many of those people as we can possibly get. Because you do have some long-term immunity with 2 shots, especially in younger people. Let me just go over the data, because I think this has been a source of a lot of confusion, not just for regular people, but for doctors too. And I've been trying to wrap my head around this for weeks now. There's different studies coming out all over the place. So if it's okay, let's just go over it a little bit, and I'll try to break it down for people.
Sure.
All right. So what we saw with Delta was more breakthrough. Okay. And some of those breakthroughs ended up in the hospital. And obviously that raised a lot of concerns, even though the vast majority of hospitalizations were fully unvaccinated. Okay. But Delta was already a couple of months ago here. So now we're even further away from the initial vaccination series for a lot of people. So one of the big studies that was done with the New York Department of Health. And they looked at waning immunity. They looked at people who got 2 shots. And what they found was that there was significant breakthrough as you got further away from your 2-shot series. And the further away you were, the more breakthrough there was. Now, in younger people, younger, healthier people, young and middle-aged adults, that did not translate into much severe disease. So the 2 shots still seem to be working in that younger population. But in older people, there was an increase in severe disease as you got further away. And I suspect that this was the study that, more than any other study, perhaps influenced the original FDA, CDC recommendations that came out a month and a half, 2 months ago, that said, okay, we're going to do targeted 3rd shot boosting. Remember, that was the big policy thing that came out about a month and a half ago. If you're elderly, you can get a 3rd shot. If you're immunocompromised, you get a 3rd shot. If you have a bunch of medical problems, you get a 3rd shot. Then they threw in healthcare workers also because we're working with all of those populations, right? That was based a lot on that New York data. Another paper that came out around the same time, though, was from the Veterans Administration. And they showed, they were looking at hundreds of thousands of U.S. veterans in their system, which is all one big system, so they can track it. And what they found was even more pronounced waning of immunity out to 6 months. And in particular, the Johnson & Johnson really stunk in that study. The 1-shot Johnson & Johnson had waned dramatically by 6 months. People who were vaccinated in that study did way better than unvaccinated. So the biggest finding in that study was that having completed a vaccination series protected you dramatically compared to people who did not. And people who were not vaccinated at all had their all-cause mortality way higher. However, they found that a breakthrough infection was worse than being uninfected and predicted that you would have a higher chance of dying. And even younger veterans, people under 60 years old, if they had a breakthrough infection, were more likely to die than if they were not infected at all. So I think the main finding from that study was that not being vaccinated was terrible. But a secondary finding was that breakthrough is a real phenomenon, and that it can happen even in younger people, and that it's bad that that not all breakthrough infections were benign. Some of them were severe. So that was a data point in the United States data pushing us towards just boosting everybody. I think that's kind of how I interpreted that study. There were a couple of big studies from Israel that I think really pushed things a lot further. One of them was based on Israeli Ministry of Health data. What they did was they just started boosting everybody, and they published the results of boosting everybody. And what they found was people who got 3 shots did better than people who had 2 shots. And that was across all age groups, including the middle age group, age 40 to 60. Younger than age 40, not really data to go by. Those people did well, even with just 2 shots. But the middle age group definitely did better. And the older age group did much better with a 3rd shot. And then they had another study, which was based on a healthcare organization in Israel called Clalit, where they looked at a 3rd shot. And the people who got the third shot had a reduction in severe disease. And that included the middle age group, age 40 to 69. So again, both middle age and elderly did better. So putting together all these different data points, my conclusion is that 2 shots is way better than no shots. That's the number 1 point. The number 2 point is that get a third shot anyway. If you can get it and you're eligible for it, get it. And they just liberalized the criteria so that basically anybody over 18 can get a third shot. And I think if anybody in Hawaii government is listening, this has to be right up there with expanding vaccine coverage right now. Is we want to get the unvaccinated vaccinated. And I know that we're getting a resistant group now that doesn't want to be vaccinated, but they're wrong and they're going to get people killed, and we need to get them vaccinated. And that's all there is to it. But the other big point is that there's a lot of people who are fairly high risk, middle age and elderly, who got 2 shots more than 6 months ago. And we're going to be in better shape if we get all those people a third shot. So we should be doing that. And those are the 2 big vaccine points for getting us through the winter. I wouldn't dare drop the non-pharmaceutical interventions until we've accomplished those things. And if it takes us a few months to accomplish those things, that's probably going to correlate with the time course for oral antivirals coming online and being widely available. So we'll have a better vaccinated population if we do this smart. And we'll have another weapon in the arsenal, which is oral antiviral therapy, which can further reduce the damage that the disease does. And then we end up in a situation where we have cases, but it's not translating into hospitalizations, right? And I think that's when it's safer to start talking about opening up, mask removal, those types of projects. There was a big push to remove masks several months ago, as you guys know, and Hawaii resisted lifting its indoor mask mandate. And I think we're all glad that we resisted it at that time. So I would like to see us keep that until we're in this better space.
Well, Doc, I just wanted to put this up. This was yesterday. Dr. Jerome Kim, our good friend, been on our show several times. But this is what he posted yesterday. Case numbers are rising yet again. How can we stop the resurgence of COVID-19? It's exactly what you said, Doc. We need to provide better access to vaccines globally. In order to do this, we have to increase vaccine production and strengthen vaccination programs to reach the needy and the hesitant, while remembering that vaccines are a part of a comprehensive solution that includes masks, distancing, and treatment. Exactly what you just said, Doc. And I don't think you and Jerome Kim communicated before today's show, but I consider you two, very high on the chain of experts. And I think that goes without saying that, hey, we are not ready, and we should not be looking at taking away distancing and taking away masks until we get this thing under control. And I'm afraid. I'm actually afraid what's to come.
I think it's always tough to know when have we done everything we can do. And I realize that I've shifted my own goalposts a few times. Prior to Delta, I might have said, okay, we've already done what we need to do. And Delta changed my thinking because Delta is so transmissible, and it proved that it can take us out even with 60% vaccinated, right? So we have that data point now. We know that 60% wasn't enough, and it really knocked us on our butts, right? So what do we need to do? And I'm trying to be as concrete about it as possible, but those would be my big 4. It would be get the vaccine rate 80% or north, as high as we can. I would love to see 90%. I would love to see us right up there with like Japan, South Korea, Portugal. We should be able to do that in this state. We have the social cohesion that if we have real leadership from the community, not just the political class, but the community, church leaders, civic organizations, schools, we can get our numbers that high, and then we can really beat this thing down and keep it down, right? So that's 1. And then I think 2 is getting everybody the third shot. The objection I already hear from everybody is, well, is it going to be a shot every 6 months? We don't know what the ultimate duration is going to be. I think the fact that young people, even though they have good memory B cell and T cell responses, got an additional benefit from a third shot suggests to me the possibility that this may just be a 3-shot vaccine, that probably that's what it needed to be all along, because we're seeing a continued improvement in the immune response after that third shot, even in young, healthy people who already had a good immune response. So it's not it's not automatic that this is going to be some sort of annual thing or semi-annual thing that we have to keep doing. We just don't know yet. But I think what we do have sufficient information now to know that a third shot is the right thing to do, at least right now, to get us through the winter. And then, we know rapid antigen testing can make all kinds of situations safer if it's cheap and it's readily available and we can repeat it serially. That's the key. You don't want to just rely on it as a one-off thing. But if we can get it into the hands of people, if we can really saturate the most vulnerable parts of the state and use it as a way of making any kind of indoor activity safer, that would be a key step forward. And then the oral antiviral stuff. I mean, guys, I don't know where that's going to shake out, but if we have another log reduction in fatality rate because we get effective treatment into people's hands early on, that really does shift things dramatically, right? Because then we really are talking about a less dangerous virus, even if it's a common virus. And that's the point at which I stop caring about case numbers and I start looking just at hospitalizations. Because, if it's a cold and we're knocking it down with vaccinations and oral antivirals, I'm not as worried about it. But I don't think we're there yet. I think we still 72%, 68% on the Big Island, which is embarrassing. I mean, we're still in a situation where I think this could knock us on our butts. And I'm expecting that that's what's going to happen unless we move collectively in a good direction here.
Hospitals. There was a doctor, I think it was from Queens. I can't remember today's press conference, and he mentioned that the hospitals are full, not with COVID patients, but with regular. And he said something really profound. He said, "There's a lot of sick people here in Hawaii." He said those words, and it scared me. Like, all right, what he's basically saying is, don't get comfortable, people, because we cannot afford another surge of hospitalizations. We don't have the room.
Yeah.
And I think that's the. We have a question here, Doc. I don't know if you can answer this, but South Korea, very high vaccination rate, but they're experiencing some surges right now, some high spikes. Any idea? You think it's because it's parts of the community that maybe don't have as high a level of vaccination, like in America? We
Can we
have.
put the graph back up? The graph that we had on earlier. I think I put the South Korea dot on there. So one of the things is if you go to like routers or one of those websites and you plug in a country, they'll show you the wave in that country. And what you'll see on South Korea is that they're having their biggest wave of cases, right? And it's because they relaxed socially. They had a lot of non-pharmaceutical interventions in place, a lot of restrictions, which they just relaxed a few weeks ago. So they're having this big case surge. But if you compare them, thank you so much. If you compare them to other countries, there they are. They're the little green dot next to Spain, in between Spain and Japan, at the bottom. That's their death. So, and if you look at their cases per 100,000, compared to South Korea now, compared to South Korea several months ago, looks terrible. But South Korea, compared to like every country in Europe, looks awesome, right? So what's happening is they're having what everyone else would consider a speed bump, but if you just look at their chart in isolation, it looks like a mountain, right? And I think it's perfectly understandable what's happening. Their vaccine rate is 79, 80%. It's very good, but they just opened up. So they're having cases amongst the 20% that are not vaccinated. Probably a lot of those are young people, and they're also probably having some breakthrough cases. But it's not translating into a rate of severe illness that is high, at least compared to lots of other countries. Now, I wouldn't be surprised if some of those people have severe illnesses, and I think their total number of deaths is higher than it has been because their case number is so much higher. But their per capita adjusted death rate is good, right? So I think I would love to see the United States doing as well as South Korea. If Jerome Kim wants to take over the United States, I'm voting for him. I would just love to have their problem. Where we're at 80% vaccinated and we're having a little surge because we opened up. They should take it seriously, of course. I'm not saying that they should be lazy about it. If they start to experience stress in their healthcare system, they should back off. You got to keep on your toes with this virus. You should never be complacent. But I'm a big admirer of their entire disease response effort.
Hey, Doc, when Hawaii had its high numbers of cases reported, the amount of visitors wasn't as high as it is now.
Hmm.
So now, aren't we also running a risk by just opening up just right across the board and running, like I say, running the risk of it doing another double take with much more transient type of um, people, coming and going. There's because there. I say this. I want to use the right words because I don't want to get myself in trouble. But I say this very profoundly that having experienced what I'm experiencing now at the airports, safety is paramount. But there's only one mechanism in place, and that's a screener screening these people coming in, and they are not doctors. They're taking for granted that this information was uploaded into a program and seeing the results on an iPad. That iPad has, I guess, vital information that says yay or nay whether you enter into the state. And then we have situation where people say they've done their due diligence, but the information has not populated or the investigating agency hasn't given it the thumbs up yet. So they're kind of in a holding pattern, and yet but they're already on island. So I guess what I'm trying to say is we found that not every information is correct. You'll still have numbers of infections getting through.
Yeah.
What I'm worried about is the general population of local residents. Yes, we can have that 70 percentile average of vaccination, and yet, we still can catch the virus. But
Yeah.
yet, what's happening is we're having wave upon wave of people coming in, and that's the thing that bothers me
Yeah.
because a body is a body. A person walking through that emergency room door is a body taking up possibly another space. And that influx will just continually go. It won't go away.
Yeah. Yeah. That's right. I mean, and again, where are most of our visitors coming from? They're coming from this country that has this major propaganda problem, right? Where people are in fantasy land about all kinds of hygiene related issues now.
Hmm.
And that 58% number is like a developing country's vaccine program. That's where the United States is. I mean, they're not even in the top 30, 40 countries anymore, right? And that's
Right.
market. That's who we're advertising ourselves to, right? So that's a problem. And the Secretary of Transportation, Buttigieg, I think he was on TV the other day, and they asked him about making sure everybody on an airplane, on a domestic airplane, is vaccinated. And he said, "Oh no, we don't think we need to do that yet. Air travel is safe. Um, you know, we have 100,000 cases a day of COVID in this country. How is it safe? We're airmailing the virus all around the country. It's completely ridiculous, right? So if they were serious about getting the vaccine rate up on the mainland, they would change that right now, right? And make that a requirement to get on an airplane. And then also add testing. It's not vaccination or testing. It's vaccination and testing, right? And your risk of transmitting is significantly lower if you're vaccinated. I think I went over some of that data the last time I was on the show, but I'm very convinced that vaccination reduces transmission. There's a number of studies that have looked at this, but it doesn't reduce it to zero. This is
Hmm.
such a transmissible virus that you still have the capability of transmitting even if you're vaccinated. So if all you're relying on is the vaccine, you're still going to have a fair amount of transmission. So it should be both. And if they were serious, it would be both. It would be vaccination to get the rate up nationally, which would be good for everybody and would lower deaths and transmission. And then also testing, particularly when you're doing large indoor communal activities like standing in an airport security line for an hour. That would be the way to go. And by the way, we could do that in Hawaii too for inter-island flights. I haven't seen any appetite for that, but we're at this 68 to 72 kind of number. We could fix that by having it be required for inter-island flights. In terms of the testing, the question always comes down to who administers it, where is it done. Having
Exactly.
lived through the experience of the post-arrival testing here on the Big Island prior to the vaccine rollout, I think it definitely added value, although it did not catch a whole lot of cases. And the reason why was because of the psychological effect it had on people. You knew if you were flying Trans-Pacific and arriving in Hilo or Kona, you were going to get tested, right? And you knew if you failed that test, you were going to get a quarantine order at the airport. So I think that had a mitigating effect on people's behavior, even if they didn't catch that many cases, right? And I had to fly in here from Honolulu. I had to get a test in Honolulu. I didn't have to do the post-arrival test because I hadn't done Transpac. But those people who did Transpac had to stand in that National Guard line with those guys, right, with their guns. Hey, buddy, do your swab. I think it definitely had a positive impact. It was extremely expensive. It was a gigantic apparatus to set up. It ended up being politically hard to maintain. And one thing we could look at is looking at more like risk reduction type strategies towards testing. So I don't know if I mentioned this the last time on. I apologize if I'm repeating myself, but in HIV, we have this concept of risk reduction. So we used to tell people, you're at high risk for getting HIV, so don't have sex, and we would scold them, right? And they would listen, and then they wouldn't have sex for a month or two. And then what would they do? Then they would have sex, right? And then they would transmit HIV. So we don't do that anymore. What we do now is we give them PrEP, or we say, if you have a high risk sexual activity, we want you to be on this medicine, and when you're at high risk, and you do it, right? So I'd like to see us, as we get our vaccination rate up to 80%, 90%, move more towards a risk reduction strategy for COVID too, where everybody coming in, we say, okay, here's 2 rapid antigen tests. They're $5 each. Here's a 1-pager on how to use them. We know you're vaccinated. We know you're trying to do the right thing, but you're coming here for some reason. You're going to see your auntie. You're going to go to your family reunion, or you're going to do the, the luau at the beach resort. Take this test before you do that. And if it's positive, here's what we want you to do, right? Is it going to catch everybody? No, it's not. Is it as good as having the National Guard there with the M16? Obviously not. But is it more sustainable? I think it probably would be. And if you combine that with with all the other things I'm talking about, I think we would have a positive impact on making the border a lot safer. And, basically every local family should have a bunch of these in their houses now. We're going into the holidays. I mean, we should all.
So let me say this. What you're just saying now is it's all about the messaging again, because if our administration is promoting lifting pretty much everything, what makes anybody think that a little iPad at the airport is going to do the trick, right?
Yeah.
So everybody's going to catch on after a while because they're doing it now. They're doing it now. And the only time they will back down is, when they see one of big word on the back, airport police walking to their direction. Then that's when they'll start to buckle down. But the thing is, you can't do that all the time. It number one, economically, it doesn't make sense. And so either we all get, the message has to be, we all get on a right footing right across and say, okay, we still have a problem, but this is the way, if we want to get out of this, like you're saying, is that we need to lick it and be patient and do it the right way. But because everybody's been through this, 2 years now, they think that, I spent nearly 1/4 of my life fighting this thing. I deserve to be free at this time, right? And then nobody gives a boo-hoo. And so everything that you've worked for goes right down the toilet again. And that cycle just starts all over again. And I think that's my biggest fear now, knowing what I know from individuals like yourself, is when it comes back, are we prepared? I mean, we had several times that no place were prepared. Everybody was asking for help. And yet you see every single person who's boasting now. If we were to play how they were talking, if we were to play back how they were talking, like that one gentleman with the English accent, right? In the hospitals, that's a spokesperson. He's always on. A couple of months back, he was all like almost pale white, talking about we're getting overrun. We're getting overrun. No, he's talking like, hey, giving one of those signals. So.
Yeah, memory has been short with COVID, and that's been a quality of it from the very beginning. New York got crushed in March, April 2020, and what we saw 10,000 people die in a month or something, and everybody was saying, oh, well, that was the spring, that was the end of the winter. Now it's summertime, so we can go outside and hang out. we dissociate because it's hard to maintain vigilance all the time. It's not in our nature, and that's why I want to do things that lower the fatality rate of the infection. And vaccination is the number one thing that's going to lower your chance of getting hospitalized or dying. Oral antiviral therapy, monoclonal antibodies, some of these other things we're developing can also lower the risk of dying when you get infected. So I'd like to see us get to the point where we're really talking 0.1% case fatality rate or lower, and then we stop caring so much about cases. But the truth is, we're just not there yet. That's the bitter pill we all have to swallow. And I think even under the best case scenario, we're probably a few months away. And that's assuming we do everything right and that we're smart. And that's why that's the drum I really want to bang is let's be smart. Let's get where we need to get. We know what we need to do to get there. It's not a mystery. The graph doesn't lie, right? It's just
Right.
math. People can make it political. They can get abstract about the Constitution. They can do all kinds of nonsense. The virus doesn't care, right? If we hit 80%, 90% vaccination rate, we're going to be in a much better situation. And if we have effective oral antiviral therapy, we're going to be in a much better situation. So let's get from here to there and not let up until we're there. That would be my breakdown.
Hey Doc, I have a question about the monoclonal treatments, but do we know why the DOH? You probably don't know, but clusters. Not I'm sorry, not clusters, but the variant report. Apparently, the DOH stopped publishing them. Is that because we don't have any variants, new variants? Are you aware of any
I haven't
variants?
heard anything from them. I'm sorry.
Okay.
It's a good question, George. I haven't heard anything from them on why they haven't updated it recently. The last I heard from them was that it was all Delta, but that was several weeks ago.
And Scotty has a question. I know he asked this today. You answered him on his post, but for the sake of our viewers, who gets the monoclonal and who doesn't and why? Let me just say, I personally know three people so far that tested positive for COVID, went to their doctor, and got the treatment. So I'm not sure. I think Scotty was talking about someone that was in the hospital. But what's the general
Yeah.
practice of monoclonal treatments?
So and this has to do with emergency use authorization and what that means. But for drugs, if something is authorized under emergency use, it comes with a guide for doctors, which is basically a PDF file. And as the guy who prescribes all the monoclonal antibodies at North Hawaii Hospital, I had to read that PDF file. I can't just prescribe it however the heck I want to without knowing exactly what the guidance is. And this is not typical, right? Because for most medicines, the doctor can kind of do what they want. So, if let's take Bactrim, for example, which is a common antibiotic. I can use it for a skin and soft tissue infection. I can use it for a urinary tract infection. I can use it for PJP pneumonia. I don't have to go to the FDA website and look at what Bactrim is authorized for. I can do whatever I want because I'm a doctor and it's an FDA-approved drug, right? Emergency use drugs are treated very differently. They're much more scrutinized. They come with these little files, these PDF files that basically say, this is how you can use this drug. Don't use it under any of these other circumstances. And if you use it under these other circumstances, you're potentially creating a major headache for yourself and your hospital. That's basically what they tell you. They say, don't mess with us, right? And then you're required to report any adverse reaction that happens after you use the medicine, and then it gets reviewed, right? So the end result is that when we rolled out monoclonal antibodies, we set up a protocol at Queens North Hawaii, and I don't know what the other hospitals are doing. I know Queens Punch Bowl did something very similar because I'm friendly with those cats, so I know what they're doing. We did it very, very similarly to Queens Punch Bowl. They did it very similarly to us, but I don't know how it's working in the non-Queens system. But essentially, we set up a protocol where it says, okay, Dworkin's the prescriber for monoclonals at North Hawaii. These are the people that get monoclonals. These are the people that don't get monoclonals. And then, if I make an exception, it's got to be some extenuating circumstance where I think that the intention of the EUA was that they would get it, and there's something weird that happened. So, for example, let's say you're hospitalized. So for monoclonals, it says don't give it to hospitalized patients. Very clearly, it says that, right? So have I given it to patients that have been hospitalized? Well, once I did. And the reason why was because that patient came in for something that had nothing to do with COVID. And just incidentally, we found COVID. So I thought, well, this person is a lot like a non-hospitalized person. They're not in the hospital for COVID, so I can do it. Now, why is it that way? Well, in some of the early studies that were done, I think in late 2020 already, patients who were far along in their illness and were hypoxic and were on oxygen, there were some bad outcomes reported with the monoclonal antibodies. So there was a concern that there was a safety issue there. I think it may have been that they had bad outcomes just because they were going to have bad outcomes anyway. It may be that the drug is perfectly safe in that population. But the instructions for the emergency use are very clear when we're allowed to do it and when we're not allowed to do it. So most of the hospitals are following those instructions. Maybe not everybody is, but most of them are. And I think that's probably what's going on. And I hope the rules get liberalized because I found the drug to be pretty good. And I don't know why biologically it would be bad to give it to somebody who's hypoxic and hospitalized. It may be too late to be useful, but it shouldn't be harmful. And there is some data that's come out more recently that suggests that it's okay to do it. So I think these rules may change. But right now, the focus for monoclonal antibodies is to get people in before they're hospitalized. So day 3, day 4. And that's been my message to everybody on the Big Island. If you test positive for COVID and you're high risk, vaccinated or not, get your butt into the clinic so we can get you that treatment day 3, day 4. It may not be available to you day 10 when you're really sick. And it works if we give it early, but it's got to be given early. And that's the big problem with it. It's an infusion. It's got to be given early. Once we have oral antiviral therapy, I think the monoclonal thing is going to be historical because it'll be a lot easier for people to take pills than to get infusion appointments, right?
Thank you, Doc. I hope that answered your question, Scotty.
And I understand the frustration too, by the way. I don't mean to be flippant about that. Like, if my loved one was sick, I'd be furious if they didn't get everything. I get it. I totally get it. But I don't think there's anything going on there. That's just the rules.
It's not discrimination. It's the fact that if you're hospitalized, you're not going to get the monoclonal. If you're early onset, you test positive, then you get it. That's the rule. It's not discriminating. It's just
that's
the way
how
the
it is.
rules are.
And even with those rules, if we give it to somebody and we're totally squeaky clean and they don't do well, we got to write a report to the government explaining what happened. And you better believe that gets read and we get, called. And I mean, it's a big thing, and there's a lot of review going on and scrutiny going on. On the other hand, we want to get the drug to the people who need it the most, the highest risk people. So the way I've resolved this on the Big Island for our group is I've said, we're going to be very aggressive about getting it to the people who need it the most, but we're also going to be teetotalers about following the rules. So what I didn't want was it to be sort of a celebrity treatment, where Hollywood guys or whatever say, well, I would like a monoclonal before I go to the beach tomorrow. And then we're teeing them up, and I'm afraid that that's how it's been used in some places. We want to get it to the sick people, but we've also got to follow the rules because we know not all those sick people are going to do well. And we don't want to be caught with our pants down having inappropriately given to somebody and then give them a side effect,
Got it. Thank you. Wow, man, that was a quick hour. We had a lot of questions a lot of the questions, have been answered in your comments. So I don't want to, re-ask the same question. Here is one though. I think that hybrid immunity, is that a thing? Someone that caught COVID getting the vaccine. Now,
Yeah.
I was told this is impossible. Getting COVID from the vaccine. I'm not sure if that's what she means, but hybrid immunity, is that a thing?
Yeah, no, there's a lot of work that's been done, in particular by Shane Karate, who's an immunologist in California. And if you've been infected, getting a dose of the vaccine after infection is very effective at producing a robust immune response. It's arguably the best kind of immunity. The problem with it, of course, is that you had to go through the natural infection in the first place, which means you might have gotten quite ill. You might have post-COVID syndromes. You probably transmitted it to other people. So I don't recommend that people intentionally go for hybrid immunity. But if you've been naturally infected, we know from fairly good data that the likelihood that you're going to get reinfected in the future is fairly high relative to people who've been vaccinated. But we also know that if you get even a single dose of an mRNA vaccine after a natural infection, that you're Superman at that point. You've got probably better immunity than the people that got 2 mRNA shots. So I have a couple of hard-headed patients I saw that avoided vaccination and then got sick, and I'm still working on them. I say, hey, it's not too late. You can get hybrid immunity, which is actually probably the best. You survived your infection. Don't get infected again. Don't go through that again. Don't spread it around. Get a shot. And the safety concerns about the vaccine at this point are fairly ridiculous, to be honest with you. We've been hearing stuff for a year now. I was worried about it when it first got the shot. That was in December of 2020. We're now in November of 2021. The argument is settled. We've got a year and a half of follow up on the original patients that got the shot. So there's no sane reason why people shouldn't be doing this.
Wow. Doc, you look like you're ready to roll, man.
Sorry, it's been a long day. It's been a long day with non-COVID care, and you mentioned this earlier with the hospitals being full. We've been very busy, and there's a lot of people who delayed medical care that are quite ill now. That we're finding people with late diagnoses, there have been a number of papers coming up looking at the social costs of all of the missed school and the lack of social interaction for the last year and a half. We're dealing with a lot of psychiatric disease, a lot of addiction-related disease, a lot of delayed diagnoses for heart disease and cancer and things like that. I mean, we have been busy, and these people need help, and this is why we can't really afford to have wave after wave after wave of COVID in the hospital. We need to catch up on a lot of stuff that got punted, frankly. So. I've always been relatively optimistic. No, I'm still optimistic. I think Hawaii is uniquely situated to do well. We've done well relative to the mainland. We've not done as well as we could have done relative to some of our peers in the Pacific. But we have the tools right now to beat this thing down and to keep it beaten down. And I really just hope that we take the opportunity to do that. And that should be the marching orders for all the politicians and not just the politicians, but the community leaders, when we're engaging with, church, civic groups, business community, is we need to get our rate higher. We need to get everybody boosted, and we need to roll out effective strategies like rapid antigen testing and oral antiviral therapy. And we can get through the winter. We can do this. We don't have to go back to 2020.
Well, I pray that we don't. I don't want to go back there. I don't think anybody does, and I really wish other segments of the community, like you mentioned, the churches, such a powerful influence on their members. But I don't see, in many cases, I don't see that coming together. In fact, I see a lot of people professing that they don't need the vaccine in churches and places of worship. I know that firsthand. I have a pastor right now sitting on a ventilator at Wilcox Hospital, unvaccinated. So, I mean, I understand, but I mean, I think we're getting to the point now that if we want to get through this once and for all, then it's going to take an effort by a whole lot more than if we leave it in the elected officials' hands, it will never end.
And we can engage. I mean, I think we need to engage with the spiritual leaders and try to get them on side. And it's not too late for honey, and sweetness, but I also don't mind a little salt. We just got to get it done, whatever it takes.
Well, Doc, that was a quick hour. We're a little over time. You want to share any personal comments or don't forget the book, guys. Plague Doctors at the what is it? What's the publishers? I had two. It's the link is Watermark.
Yeah, Watermark. Yeah, Watermark.
Yeah, just Google them out.
I'm super excited about it, and the production quality came out really good, guys. I'm so happy with that. It's a beautiful object. They did a great job with it, and I'm very grateful for all the people who helped put it together. And I never expected it to blow up internationally or anything like that, but I did my best to write a good history. And I'm committed to getting everybody a signed copy who wants a signed copy. We'll make it happen one way or another, even if there's some delays in gathering. So I appreciate the support of you guys and the community.
Anything else before we sign off, Doc? Any words of advice?
No, that's it. We covered it. Thank you. Thank you for having me on.
Charles.
Oh, boy.
He's so exciting, man. I got to tell you, you get fed with information every time we get Dr. Dworkin on, man. I got to tell you.
Well, thanks, Doc. Thanks for joining us tonight, as always. It's a interesting night. Very a serious topic, but you make it very palatable for everyone to understand. And to our special viewers out there, all of you are special, I should say. Thank you for joining us on this special Tuesday edition since we weren't on last night. I'd like to say again, thank you to all the returning residents for your patience and for just putting up with the rules and regs that we have at the airport. I see you all, and you're just, you don't give us a hard time, and we appreciate that so much. So thank you. And to the rest of you out there, I guess tonight's word of the day shall be patience. Things are happening. We just got to be patient. We push this issue, and the worst thing that can happen, like they say, when you got the bad guy cornered, don't rush into it because the bad guy can escape. And this may happen too if we're not careful. So just be patient. Uh, get whoever hasn't been vaccinated yet, tell them, hey, how's about joining the group? If not, don't be too harsh on them because they got their reasons. And just make sure, just make sure that everyone around you is safe. And for those in Honolulu that I left couple yesterday, thank you for hosting me for the entire day while I was there working. But man, that place is crazy. That's why I was born and raised there. But man, that place is crazy. So I love it here on Kauai. If it takes me 2 hours to reach Waimea from Lehui, I'll just enjoy that peanut butter sandwich I brought with me. Until the next time, take care. Aloha, and turn it over to you, Mel.
All right, guys. For the, many of you guys asking where you can find the book, it's at Plague Doctors, Watermark Publishing. You can go to bookshawaii.net, bookshawaii.net, and just search for Plague Doctors, how Hawaii battled the pandemic. Go get it. You can pre-order. It's actually being shipped out now. So yeah, Plague Doctors books. What was it? Bookshawaii.net.
Bookshawaii.net. That's right.
Bookshawaii.net. I tell you, I coming like amnesia, just like some of our leaders. Anyway, guys, thank you so much, Dr. Dworkin. Appreciate you. I'll be honest. I was frustrated today, and you know what? I tell you what frustrates me because I'm an optimist too. I like to be optimistic. Whenever UH gets on the field, I'm optimistic that they will win. But if they didn't prepare, if they don't have the right tools, if they don't have the right skills, they will fail. It's no different, right? If we have the tools, we should have the skills. We have the clues. We have all the tips from other countries and other states, but we choose to. But what frustrated me the most was the happiness in their faces and their voices because we're bringing back the economy and people are going to go back to work, and the visitor industry is coming with more people than we ever did pre-pandemic. We're happy. It's time for celebration. That's what frustrated me the most, Doc, because I watch the trends, I read the articles that's going on. I know Scotty keeps talking about Florida. What was Florida's success? Well, I don't know if you've checked, Scotty, but Florida is experiencing a surge right now in the last week, and that's what happens. This thing you can go well, and then it just takes one super spreader or one event or one unsafe person. So Florida is not the model place anymore, and it's that's the scary part about COVID. It's we are
Hey, Mel,
vulnerable. Yeah,
Mel. But just tell them, I enjoy watching you when you say they just smiled and they were excited, right?
yeah,
But tell them, look at their face when they pull into the nearest gas station and look how much you got to pay per gallon.
yeah.
That smile goes the other way.
It would
I
be
mean,
nice if the leaders of our state, instead of acting like cheerleaders, would articulate what it is that we need to do, and help us get there by setting policies to get us in the right direction.
Exactly.
Because I don't think I don't think the happy talk really fools anybody. Um, and we all know where we're going to be if we don't do the things that we need to do. So
Yep.
uh,
Yeah,
I'm
well,
always a little surprised at that.
if you watched it, you saw, everybody from the restaurant associate. Oh, again, where was
Yeah.
Dr. Libby Char? I don't think Dr. Libby Char is comfortable going up there in front of the world saying that. No, and I respect her for that. I really do. I don't
As
think
do
that
I.
that that now, if I was Dr. Char, I'd stand up and say, "Hey, I disagree with this move, but whatever. I understand the politics. My point is this, Doc, they should have had someone like you come up there, infectious disease specialist, been studying COVID from day one, is caught up on all the studies. This is the deal, guys. We can make it happen, but these are the things we need to do. Versus that
Shockingly,
that
I don't think the tourism authority is buying too many copies of my book. You guys will be shocked to hear that.
No,
I heard they bought 500 of them, but that is just so they can burn it on the beach when they have their bonfire for their tourists. It's pathetic.
we just got to remember one thing, and you said it, Mel. You want to bring the right person on to deliver the right message, and this guest of ours tonight would have been the perfect person. And I always use that analogy. If you need to go see a proctologist, right? You don't bring somebody that specializes in rota. It's just not going to work. Okay, you bring the right person that can handle the job. And and you're right. It's very frustrating when you get someone in there, especially I was one of those in the very early on stages promoting her because I had the opportunity to work with her when I was at the medical examiner's office because I liked the way she operated. She was straightforward. But I guess, like you said, when it's clouded with politics, people get jaded in such a way that they say, "Oh, no, no, I just don't want to get in front of the camera or whatever." And if it's for the betterment of the entire community, why not, right? Why not? If you know you're gonna do something good, why not? So,
There were, like I said earlier, there was only one I think only one guy from Queens or wherever, and he cautioned everybody that the hospital beds were full with non-COVID patients, but no other expert in the way of epidemiology, virology, infectious disease. Nah, because that's not the goal. The goal is to restore the economy, and they're doing a damn good job about that. So
We know the cases are going to go up when they do this. There's just no question. They know the cases are going to go up. The question is, are they going to be able to avoid a hit on the hospitals? And if they think that they are, I think they just need to look at that graph that we produced and look at the experience of
mhm,
other countries. And then they'll
yeah,
realize we're not quite there yet. We're better than the mainland, but we're not quite there yet. And boy, get us there, then have your party. You got
yeah.
you don't do the dance in the end zone when you're on the 20-yard line. You got to get into the end zone first. So
Oh yeah. Oh, when you're losing 40-6, you scored your touchdown. 2 minutes left. And you celebrate like you won the Super Bowl when you just lost your ass. That's kind of what happened today, and it's no fun. Hey, to the village, thank you guys. We love you guys. We appreciate all of you. Remember, guys, stay safe. Share aloha, guys. The village is gonna get us through this. Thank you for being a part of it, Doc. Always a pleasure, man.
yep.
Appreciate you so much.
thanks for
Take care.
having me.
God bless. Get the book, guys. We'll talk to you guys soon.